So meta.
Oh
Okay.
no.
All right.
Are we?
Yeah, we're gonna do it. Let's do it. Let's do it. Step
Okay.
foot. Okay. 5, 4, 3, 2, 1. All right. So we got our binder together. You got any more homework assignments for me? What else do I have to do now? Oh yeah, you do have more homework. Here's what else you got to do. Right. You're gonna have to do some like diagnostic questionnaire things to kind of see what you're in for. Okay. So here's what you're gonna do. You're gonna let Luna talk now.
So in general, what to expect at your first appointment is them doing a physical exam and a history, but they also probably will use what's called a screening tool. So it's just a tool that was developed with medical research that helps predict the likelihood of a certain condition. So this
Okay.
is medical research backed, and it's a scoring system that they use. We're actually going to go over, 2 screening tools.
Okay.
Basically, it's based on the idea that, there's certain warning signs or common experiences, right? So the current diagnostic guidelines indicate major and minor criteria for each EDS subtype because they vary, but due to the great variety and overlap of how the different types of EDS present, genetic diagnosis is preferred for
Okay.
all the subtypes, except in the case of HEADS because we don't know the gene for it. And researchers are actively trying to find the gene for HEADS, but in the meantime, since it's the most common type of hypermobility disorder, it's likely that you're just going to be diagnosed with a clinical evaluation. And so your preparation and documentation is going to be vital in that because, in all likelihood, you're not going to be able to be tested. So go ahead and go to the website when you're done with the podcast, print out these screening questions, put them in your binder. But right now we're gonna ask them. So
Oh, we get to do
let's
homework now?
yeah.
Okay. All right. Well, this questionnaire, I have heard there's called a simple questionnaire to detect hypermobility. Apparently 85% effective.
Yeah. So let's ask each other the questions. Do you want to do a good old TikTok put a finger down challenge?
Ooh, I have never made a put a finger down video. Did you know that? Never.
They confuse me. So I'm going to be very explicit. Put up 5 fingers in one
Okay.
hand. Okay.
Okay.
And then every time I ask a question and it applies to you, put a
Okay.
finger down. Okay.
Okay.
So every time you answer yes to one of these questions, put a finger down and we'll
Okay.
see how you score at the end.
Okay.
Okay. So number 1, can you now or could you ever place your hands flat on the floor without bending your knees?
Yes.
Okay. Can you now or could you ever bend your thumb to touch your forearm? And if you don't know what I mean, I'm going to
She
try
can do.
to,
I cannot do that anymore.
and I popped, but
I can't do that anymore. I was able to do it with my left hand, but I can't do
okay.
it anymore.
Number 3, as a child, did you
Hold,
amuse
but I
your
need to put my finger down though then because I could do it.
yeah, because you could at one time. And that's important. The question was now or ever.
Right.
Number 3, as a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits?
Yes.
Okay.
So I'm 3 for 3 now.
Okay.
Okay.
As a teenager, did your shoulder or kneecap dislocate on more than one occasion?
Yep.
Okay.
My knee. Right out
Number
the
5, do you consider yourself, quote, double jointed? Okay. If you
that's
have 2 or more fingers down,
Oh, it's only 2?
you might have generalized hypermobility.
Ah,
Shelly, how
okay.
many fingers did you have left?
I had no fingers left. All gone.
Yeah, sure,
Hey.
hand is gone.
I
I
mean,
would
kind
also,
of.
if I were to have been doing this along with you, I can't do both. I also would have every finger down.
Yeah. Okay, so
So
all my
that's
fingers are down.
85% accurate that you have some sort of hypermobility issue. Okay. So there's another list too. I'm gonna let Shelly ask all
Yeah.
these questions.
Yeah, I'm gonna ask these questions. And There's no hands involved with this that I can tell, but you're
There's
gonna
too
answer
many.
you're gonna answer the questions, and I'll just nod. But this is more about you since I got to do the hand thing. Okay. All right. Do your joints feel like they pop or slip in and out
All the time.
all the time? Okay. That's a no for me. Do you easily injure yourself?
Yes.
100%.
I don't
Okay.
even know how sometimes.
Yeah. One of my husband's nicknames for me, and he does say it with love and care, is Captain Concussion. Anyway. Okay. Number 3. Do you bruise easily, scar
Yes.
easily, have
Yes.
stretched scars, or varicose
I do
veins?
not.
You don't
I
have
do have a
stretched
thing.
scars. Okay.
Mhm.
I think some of mine are stretched. I'm gonna do pictures later, but okay.
But so when I answered that, I did not think I had any interesting scars. However, I've been told I do. So they're just not atrophic,
Oh. I
but they
had
did
one that
heal
kind of
weirdly.
slowly, like I had a chunk taken out of my shoulder that they thought was whatever. And like when it healed, it raised up and was like this bump. And
Yep.
I actually was very
Keloid.
self-conscious of it. It was keloid and it looked, what I didn't like about it was the location. It looked like a big back zit, is what it looked like.
A big what?
A big back zit.
Oh,
Like it looked so
like
like,
it wasn't
yeah.
just obviously a scar.
And so like I was self-conscious about it because I didn't want people to think I had back knee, which
Hmm.
whatever, like who cares about that? Like that's the type of stupid shit I was concerned about like back in the
Right.
day. And now I'm
Yeah,
like,
exactly. It's
and
always,
now I'm like,
yeah,
fuck y'all, look at my cellulite. I got under eye bags. Yes, I walk
right.
weird. Come at me. But don't really come at me because you're gonna make me fall. Um, so yeah. So okay, so bruising veins. So you didn't think that was significant.
I
And
didn't.
there's probably a few reasons for that. Either people around you had the same
It
things.
didn't look abnormal to me. Exactly.
And
My context was different.
yeah, well, and because it's genetic. So
Mhm.
next, oh, this one's interesting. Do you experience a lot of acid regurgitation or fullness or nausea, abdominal pain, bloating, constipation, or like feeling sluggish? So sluggish, that's like, oh, I ate, got to take a nap now.
No, it's like your bowels are moving slowly, like slowly
Oh, so
moving.
bowel sluggishness. Okay. So
Yeah.
you got some yeses in that one?
Yep.
Yeah, same.
And it has varied over time.
Oh,
At one point in my life, it was debilitating.
ooh, that's not good.
I
Okay.
basically I was diagnosed anorexic because I couldn't eat. It was a misdiagnosis.
Well, yeah. They're like, oh, you have an eating disorder. I mean, and anyway, yeah.
Yeah, we'll talk about that on another episode.
All right. So number 5, if you're keeping up with us on your little handy dandy checklist at home. All right. Bladder concerns. Do you have bladder concerns?
So
Mm.
many.
Okay, so that does include bladder concerns include the following. Ready? Difficulty passing urine, recurrent burning sensation during urination. If you have a prolapse front or back of the bladder, you can sometimes tell. I can tell how my bladder is doing based on, and this is going to sound crazy, how my stream is coming out.
Yeah.
And I didn't
Yeah.
realize. I didn't realize at the time that was actually a message my body was giving me. But like, so yeah, if you notice the way your stream comes out,
Yep.
that's something you need to
And
take a note of.
we'll do like further episodes that go more into detail into like
Yeah.
specific body systems and that sort of thing. But for women, a lot of our signs and symptoms are in the lower organs, so
Yeah.
pelvic
Pelvic
cavity
floor.
organs, bladder, and the reproductive organs, all that sort of stuff.
Yeah.
Experience some of these things.
Okay. Next. All right. We're staying with some body systems that you might not think. Do you experience fast heart rate or feel faint? You might also know that's also called pre-syncope or syncope. And when you stand up for a long time, do you also feel like you might pass out?
Yes,
Yeah,
and I thought everybody had to take a little time to get themselves back together if they bent
same,
over.
same, same. Yep. All right. Um, well, I'm sorry, but if you've answered yes to 1 through 6, you're probably going to answer yes to number 7, which is, do you feel anxious or depressed? Yeah.
I thought that was just my only problem for years.
Yeah. Well, yeah. And then when you really step back and look at it, you're like, well, of course I'm anxious and depressed. Do you like see?
I was diagnosed with those as a child, we should point out.
With anxiety as a child?
Clinically. Yeah. Now I know is autonomic dysfunction.
Yeah. And emotional.
Dysregulation because
Well,
of
that
autism.
and just when you're like, when you're constantly like brushed aside, so then
the
it builds,
gaslighting, the
it builds and builds and builds.
invalidation,
Okay, so number 8, do you constantly feel tired or unrefreshed after sleep, and you can't think clearly or have brain fog?
Yes.
Yeah.
And that
I
may
mean,
be the most frustrating, honestly.
I'm with you on that. I mean, obviously my answer is yes. If you've listened to this podcast, you know that yes.
Yeah.
All right, number 9. This is fun. Do you have any vascular problems, eye issues, bowel complications? And that's for you or your family. Actually, it's probably more your family because
Yeah,
we've
this
already
one is
talked
your
about. So
family.
this is getting into your family. So think about your mom, sister, dad, maybe grandpa. For me, it was my grandparents' generation that had many of the issues.
Mm-hmm.
So vascular problems. When you say vascular, does that mean stroke or does that mean any type
Anything
of
to do
rupture?
with your vascular system. So
Okay.
aneurysm, stroke,
Any type of organ rupture?
perforations, ruptures,
Okay.
bleeding, issues.
Okay. All
Yes.
right. So if you've gone through this checklist, you've got some notes here on whether or not you've said yes to these things. And what do they do now?
Just to point out something helpful for you here. So if you've gone through these questions, it probably sparked a lot of memories. So go start making your notes. Use that as a framework to take down your history. Also, these questions are super helpful if you have family members open to having this conversation.
Yeah.
So you can use those.
Something I want to add to this, and I know this list came from a book, which is why it is what it is, but I want to add another thing that I think people should be mindful of, and it's dental problems. Like not just like cavities. I'm talking, do you have a hard time getting numb? When you go to the dentist, do you have excessive bleeding, or do they yell at you for not flossing even though you floss and use the water pick? Did you all of a sudden
early periodontal disease, early gum recession, lots of cavities for no reason?
And so mine didn't get bad, honestly. Okay,
jaw issues.
This happened for me. I didn't start having dental problems like I do until after I had mono when I was 20. Once I had 0 cavity. I got my first cavity when I was 23 years old. And since I was 23, I had mono when I was 20. Since I was 23, and then I had 2 kids, and like
did
ever
you
since
have
then,
like dental crowding palate issues?
Now I did. I never had braces. In hindsight, now I think they probably should have gone in and like widened to my palate, but they didn't know. They didn't do that in the early 80s.
I had braces twice.
Oh, did your mouth
should have been a sign?
Did your mouth shift back?
Almost immediately.
Yeah. Because it's like, I'm not doing this. Yeah. So I never had my palate expanded, but I did have to have my wisdom teeth extracted. And I mean extracted, because they were in there and they were about to fuck up the rest of my mouth.
So what's interesting is wisdom teeth, supernumerary teeth, in excess or absent are common with EDS. We either have lots of extra teeth or we don't have a single wisdom tooth.
Yeah.
I didn't have one.
So I had all 4, and they had to cut them. Like they had to dig them out of they were so in. And when he was done, I had the worst recovery. But he said to my mother, on a scale of 1 to 10 in difficulty and like all of the extractions I've done, and I've been however many years he's been doing I don't remember what he said. Mine were an 11. He said it was he said he was, and at first when they were first having the conversation whether they were going to put me fully under or just do local, I requested. I was like, I can't. I was like, I have a very strong guy. Like, you need to knock me out. And I mean, I was only 18 when this happened. They did it, and I was. And I'm glad he was like, I'm so glad we knocked you out.
Experience warning signs in in dental work or dental treatment,
Yep.
just like what you said. So that's,
Yep.
we've talked about eye exams, we've talked about dental exams and complications, that those are some not interventions, but those are some providers opportunities that occur early in life that we're kind of missing. So we both experienced warning signs and
Yeah. And I mean, of course, lots of people who've had their wisdom teeth out. Lots of people who've had braces. But do you know lots of people who've had their wisdom teeth out, had complications, but also had all of these other complications? Like you got to look at
it's the whole picture.
It's everything. Because on the surface, like I could probably walk through my neighborhood and find quite a few people who have had one of those things, but all of them, probably not.
And a big sign you mentioned was not reacting to lidocaine.
That too. Yeah.
So print out those questions, go through, make your notes, add it all to your binder. And then once you have all this together, you've got all your records, you have all your paperwork, you have all your chronologies, your symptoms. Then once you're organized, it is time to try to find a doctor to help you with this. Ideally, we want to begin our journey with your trusted primary care doctor. A case can be made that all hypermobile patients should be managed by primary care, but automatically many PCPs refer patients to a specialist just due to their lack of training and awareness and being comfortable diagnosing you. So expect resistance due to that lack of awareness and just the tendency to refer out anything that seems like a specialist should be handling it. So truly the needs of a zebra, though, should be focused on managing all of the systemic needs, and we need help coordinating all that care. So in my opinion, primary care is the most functional arena to coordinate the complexities of our care, and that's who you should start with, and then in the end, who should help you manage all of your healthcare.
So they're like the hub of the...
Yeah, exactly.
Okay.
I mean, that's their role generally in medicine anyhow.
That's what they say, yes.
Should be.
Then, ideally.
Ideally. Even if your PCP is not familiar with the diagnostic pathway explicitly and evaluating hypermobility, they can do that. There's easy resources available to them. We'll link them. Many PCPs are willing to learn and help and at least evaluate your level of hypermobility. You just have to ask. We recommend kind of doing some work ahead. So give them a call up your doctor's office, ask to talk to the nurse that works with your primary care doctor, and ask that RN if that doctor is willing or has ever done an initial assessment for hypermobility. And if your PCP is willing to learn a bit to help support you through that journey, there's a great resource it's the UK support sub website. So it is not US based, but it's still a great resource, even if you and your provider are here in the States. They have a whole toolkit. It's for general practitioners in the UK. They refer to them as GPs. That's equivalent to the American PCPs or primary care providers in the US. So we recommend sharing this information with your provider, even if you're in the States. They have a great resource. They have a lot more resources on their website for diagnosis, school accommodations, all sorts of great things.
Yeah, their website's pretty good. Besides finding like resources in the medical community, you can also find local support groups, both in person and online. I prefer the online kind. So there's local hypermobility and EDS support groups that are probably chapters. I actually haven't looked at this. You can confirm this, and I assume there's local chapters that do things. And if you have a good relationship with your primary care and they actually know about hypermobility, they might actually have resources that they can refer you elsewhere. In all likelihood, like Luna said, they will be there to support you, but they might be like, I support you. I see where you're going with this, but I'm going to pass you off to, you might hear a rheumatologist, and they might say a geneticist. Most people, I think, start with the rheumatologist, because when you think
That's a
geneticist,
common pathway. Yeah.
I don't automatically think, oh, I'm going to go to a geneticist. That to me seems more like a researchery rather than like a clinical diagnostic type thing. So what is a rheumatologist? If you don't know, a rheumatologist is a type of physician who received training in the detection and treatment of diseases that affect muscles, bones, joints, ligaments, and tendons. What are all of those things, Luna? Those are connective tissues. So
Yep.
unfortunately, and this has been my experience, not every rheumatologist is comfortable and they haven't received training in the detection and treatment of it. So even if they have received whatever training they have, it might be pretty minimal. So they might not even be comfortable evaluating you, even if they know a little bit about it. So if you don't already have a rheumatologist that you are comfortable with, like Luna said, go ahead and give them a call, or find out if it's not your doctor at that practice, if there's other doctors at that practice that might help you. Just make sure. You want to make sure it's not going to be like the cardiologist appointment I had a few weeks ago. A geneticist. So a geneticist is a scientist, and that they may or may not be a medical doctor on top of being a geneticist. Usually they have a master's degree. They could have a PhD also, but they might not be a medical doctor, but they're very highly trained in genetic testing and looking at familial stuff to determine if you have an inherited disorders. So if it's indicated, the rheumatologist or some other specialist may refer you also to a geneticist, who will be a great resource and might opt to do the testing to rule out those more rare and problematic subtypes we discussed earlier. But they'll help you make all of those decisions and the referrals. And in the end, I ended up working with a geneticist who diagnosed me, and it was amazing. So
Yeah.
I never in a million years would have thought a geneticist would be the one that would diagnose me, but that's what happened.
Yeah. I didn't really expect that pathway either. Our road to getting diagnosed was a little different, but in the end, similar. When I was diagnosed and saw the genetics clinic, what was interesting is I met with both a PhD and the clinical geneticist, so like an MD with genetics focus at the same time. It was the coolest appointment.
Well, wait a minute. Everybody was like talking with each other and sharing information and knowledge.
Yeah, no, yeah. And
are you dreaming?
They may be my most favorite providers I've ever met, because they totally respected the nerd out tendencies that I have.
Yeah.
And they were happy to share their hyper focus.
Yeah. You didn't get eye rolls and, oh, you
No,
really
not
shouldn't.
at all.
You really shouldn't Google that.
Yeah. And my geneticist, the doctor, he said, no, we don't really manage your condition, we just diagnose. But if you ever have a question and something's not making sense, have your doctor consult with us, or come back and see us, or call us. You're always a patient, and we can help recommend what types of specialists to see. So for example, if you're having POTS or autonomic dysfunction, you want to go see an autonomic dysfunction specialty type of cardiologist or vascular specialist. You don't want to just go see a heart surgeon or a cardiologist, because they'll be like, that I don't deal with that, for example, because there's
and that's what happened to me with the cardiologist. He referred me out.
Mm-hmm.
I think he thought she had that specific knowledge, and in fact, when I looked her up, it said that in her profile. But what it turned out was that,
and it's so frustrating, because you probably paid a copay, and
she ended up she didn't charge me. She didn't. She was like I started describing all of my stuff, and then I was like showing her my hypermobility, like all that, and she was like, I don't have any EDS. Any EDS patients. And I was like, well, I'm not really here for that. I'm here. And she's like, I don't have any POTS patients. I don't know.
So what was really cool when I went, so there are not many autonomic specialists. When I went to the autonomics clinic here where I live, we do have one. The nurse, I clocked him as soon as I walked in. He was a Marfan patient. And he's like, yeah, this is why I do what I do. I'm in this clinic. And he was like so excited to meet us. And he was like, will you let me know how everything goes? I want to hear about her and stuff. And so oftentimes you may
would
actually
he talk
be
to
seen
us?
in a, he might. He was really nice. But also I should
Just
mention
because
this was
that's a
in the
connective
context.
tissue that's not EDS. Like that would be.
Yeah, yeah. Um, but he he said he recognized it as soon as we walked in. And he said, "You're my favorite patients because other connective tissue disorders, we just understand each other." And I was
Yeah.
like, oh.
Yeah.
But so anyhow, it's interesting that he also clocks it easily and sees it, like what you were saying
Yeah.
earlier about seeing it everywhere.
Mm-hmm.
You recognize it more. Now
Getting
there's
there and
not,
behind,
like we said, we're not everywhere, but we're there. Yeah.
hiding in
Um,
plain sight.
yeah. But a
Yeah.
key point to know is, while you're going through all this, while you're waiting for answers, still seek care. If you're waiting to see a specialist, there might be a wait time, right?
Yeah.
Seek help with your PCP. They can help you coordinate care. For example, like you may need physical therapy, mental health support, consults for specialists. They can get that going. You don't need a diagnosis to start treating your other
Right.
issues. Yeah.
And that's a great segue into what to do if you have concerns about your child.